Hello, Judith. I'm so glad to see you today.
I'm happy to see you as well.
Yeah. So please let us know where you're located right now, where you're speaking to us from, and what kind of work that you do.
I'm located in Albuquerque, New Mexico, and I've been here going on 23 years and have a focus that's evolving, but certainly in the last 8 to 10 years, my shift in my private practice has become more integrative, more holistic, and I also treat children as young as 5 to 6, as old as 80. So it's quite a mixed practice. I still do individual and couples work, and if need be, some family therapy. Overall, though, the focus has been on teaching and educating both the individuals as well as groups in the community to understand that the paradigm that the brain is not connected to the body is really something that needs to shift, and that we need to fully understand for us to have a healthier emotional, mental life, we need to address our physiology. We need to also address our spiritual life, and also come from it from a culturally sensitive perspective. And so I've really allowed for those pieces to become more prominent in my practice. I also bring in supplements, nutraceuticals, homeopathic remedies, and really try to address the root of the issues that people present with. The beauty of what I've been able to do has allowed for me to encourage people to reduce their exposure to medication, particularly psychotropic medicines, as well as reduce their health issues, because often we are addressing basic physiologic challenges people have that impact their mental health.
Now, you're very unusual as a psychiatrist because you're talking about reducing psychotropics, whereas most people think of psychiatrists as being there to help with amplifying the use of psychotropics in a way, juggling them. And what made you change?
Well, that's been a learning process, and I would say that the families and the patients that I've worked with through the years have really worked on educating me in that regard. And since then, I've done my own educational journey around that. When the newer antipsychotics came out, I noticed, being a child psychiatrist, obviously we used them early on. I noticed a trend that was quite alarming, and the research and the information that was hidden by the pharmaceutical company, particularly Zyprexa, became increasingly a concern for me, as I would see an inordinate amount of weight gain in children on these medications, and also challenging enough the behaviors that the medication stated that they would change or modify really didn't. And so I was in this conundrum of having had children with incredible weight gain, multiple medications, and yet the problem that they presented with still existed.
So I think what we need to do is just stop there, because that's a brief intro to your work and also a bit of a cliffhanger, because you've clearly got lots more to share about this. So let's stop there, and in the longer presentation that you do, and when I'm interviewing you, then we'll talk some more about psychosis in particular and what you're doing now in order to help people who are having what's often called a first break. So thank you so much.
You're welcome.
And we'll see you soon.